Hi, I'm Dr. Sue. Welcome back. Today I'd like to talk to you about our virtual consultation process, otherwise known as our long distance consult. This process is something that has been developed over time because of a need for some way to communicate to our patients what we can do for them, for our out-of-state patients. Currently at Artlipo, we probably treat about 100 patients a month, out of which about 70 come from other states and other countries. We have a lot of people coming from all over because of the difference in what we do. A lot of the cases that we do are types of liposuction, 360, celebrity arms, lipedema, things like that, the Gruber booty, that are not really available to people in a lot of different areas. So we do treat people disproportionately from out of the area. And we had to come up with a way of showing patients what we can do. And being the artists that we are, I've always done some type of drawing for patients, even when they're coming in from in-town consultations. We would take pictures and I would do some simple drawings on those photos to show patients what they would look like afterwards. Very valuable thing. I think just over the years I've honed this process into a technique that works very well to give you a good representation of what you can expect. Some people ask me, well, how can you draw on pictures and expect that to be something that is going to be accurate? Well, I'm an artist. I've been a figure artist since I was 16 years old. I have a fine arts degree from Rice University, my undergraduate degree. So I've taken tons of art classes with a human figure as the subject. So life drawing 101, 102, 201, 202, sculpting and everything else. All these different things have given me an ability to visualize what's underneath that fat. Knowing it's not just, what you learn in med school. It's actually, goes much further than that, about taking a picture like so, which is very typical of what people send us. This shape right here is not flattering because of the fat that's sitting on the outside. And what I will be doing for you, just to give you an idea of what this looks like, is I'll be drawing on these photos after I visualize it and know what I'm going to be able to create. So this is a very powerful process. It's something that I don't think I've ever seen any other practice do anywhere. There are some practices that will take a photograph of you with a special camera. I've seen this done with the breast, where they can augment the breast and change the size of the breast. Never seen it done with anything on the waist, the thighs, the arms, or anything else, because these programs really aren't set up for that. However, you could call what we're going to be doing kind of like a old-fashioned Photoshop. I'm going to take your photo and I'm going to actually create on that photo something that you can take a look at when I send it back to you. So I guess we'll just get started here, and I'll do this process. So we'll start off with the photo that I just showed you. What we're going to be doing right here is creating a new shape for her midsection, what I call the hips, waist, and back. This area right here between my two fingers. This is going to give her an hourglass figure, and I can just look at this patient's body, and based on different landmarks like where the hip bone is, where I know the curve can start right here, I'm going to create a new shape. Okay, so the first drawing that we're going to do is on this picture right here, which is the back side of this person standing. And we're going to be doing her hips, waist, and mid-back. That's going to be the area from her underwear line all the way up to her mid-bra. And what we're doing here is we're creating a thin torso. Some people call this the flanks, but to be more exact, flanks is just side, the term side, but we're doing the hips, waist, and back. What this is going to do is create an hourglass shape, which is going to not only thin her midsection, but it's going to accent her butt. It's going to make her butt look rounder, and it's going to make her whole body come into harmony with each other, because right now it's just the midsection that has gotten out of shape. So here we go. As I'm drawing here from the mid-bra line here, I am visualizing where her hip bones are, and I'm creating the curve that I'm going to say I'm usually on the conservative side. So what we create is actually going to be at least as good, if not better than what I'm drawing. We hate to do something that's drawn too aggressive or done to too much of a degree that we can't accomplish it. So anyways, this is how it works. And I do the outline first. What I do after that is I create a kind of a backdrop of a frame, because when you only draw the outline, it's really hard for the eye to picture the new shape. But when we create this frame, it took me a long time to figure this out too. I used to just draw the outline of what I was going to create, and people really just couldn't picture it in their minds. But when I create this this little background box and color it in a dark shape, it really allows people to see exactly what we're doing. So here we go. This is the new shape, and I'm going to hold these two images up side by side so that you can see what the before looks like and what the after is going to look like. So in any case, that's how simple it is. But like I said, I'm the only doctor that I know that does anything like this. And it's so important to be able to visualize what you're going to create, because not just for you, the patient, because you want to know what it's going to look like, but it commits me to something, and it forces me to figure out in my own head what is there. When someone goes in there, when a doctor goes in to a surgery and just starts removing fat with a volume in mind, they're not really picturing what it's going to look like in the end. And if you understand anything about psychology, it's hard to reach a point it's hard to reach a destination unless you already have it in mind. So that's something that I found to be true in liposculpting and true in many different things. Okay, so thank you. We're going to do some other areas too. I'm going to do the hips, waist, back from the front here, and I'll show you that to you quickly. And then we'll do some arms. One thing about doing the hip, waist, back from the front is that it really, surprisingly to those who've never seen this, will make the breast look nicer, as well as making the waist smaller. It's all about proportions. What you do in one area can significantly affect how other body areas look like. And this can be for good or bad. If you don't treat things in a proper way, you can actually make one area smaller, yet leave other body areas looking kind of strange and out of proportion. So here we go. This is the hip, waist, back from the front. And I want to show you the before and show you how the whole body doesn't look good right here. And I'm going to show you something in the after where the hips, waist, and mid-back look a lot better. But you also see how this accentuates the look of the breast. It makes it look fuller and more round. And actually it makes the hips and outer thighs look very nice too on the after, because everything flows. Okay, so now we're going to do an evaluation on this patient's arms. We do something called celebrity arms here, which is a trademark procedure where we do the entire arm and all surfaces circumferential, which is not what other doctors do. Other doctors are limited to just doing the underhang of the arm, which is what they're taught. But like I said, we do some very advanced things here that nobody else in the world does. So celebrity arms is our trademark procedure, and I'm going to be drawing on this patient's arms right here so that we can see all the nice slimming, but also toning and definition too, and what's hiding underneath her arms. So what I'm going to be doing here is drawing the outline first. I'm going to start at the top, and what we're seeing is bringing out some of the definition of her biceps. Because again, people always ask me, how do you know what it's going to look like? Because I've treated so many. We've done about 2,000 of these arms here, and I can see what is the shape of the arm to a very accurate extent before I ever touch it. And I'm doing this over and over again, many times a day, for people that send me pictures from all over the world. And what you see is the results that we create on our website, in our video galleries. So if you're a doubter, go and take a look. We don't just talk about what we can do, we show it. And here we are doing the lower half of the arm, and the other side left undone. So thank you for watching us so far. I mean, we've done drawings of the hip, waist, and back, and also the celebrity arms. We also do this for all other body areas, including the tummy, the inner thighs, the legs, the ankle area. We do it for chins, we can do it, it's kind of harder to show exactly what breasts will look like. It's hard to capture the angles and such, but we can do it for most body areas for liposuction. So again, thank you for watching, and we look forward to having you send us your photos. The sooner you send us your photos, one of our doctors, either myself, Dr. Hamway, or Dr. Gruber, will be drawing on that, and then our consultants will actually send you back the photos, usually within a few days. And this whole process, this is our virtual consultation or long distance consultation process. It's free, okay? A lot of doctors charge for their consultation process. We don't. Although this was started as something that we did for our long distance patients from out of state and out of country, it's become very popular for our in-city patients, those in the Tampa Bay area. Because as we know, everyone's busy these days, and when you can send us your photos at your convenience, we can do this for our local patients too. So again, thanks for watching, and I hope to hear from you. Bye-bye.